Thank you very much. It's a pleasure to be here. And as Larry mentioned, Dr. Dougal Seeley was meant to be speaking here today, but he wasn't able to attend, and it wasn't just that the dog ate his homework. This is what he was up to a couple of days ago. He's been awarded the Dr. Rogers Prize for complementary and alternative medicine, so excellence in complementary and alternative medicine, and was actually awarded quite a large prize, which we'll be putting towards some research, I'm sure, in the future. But he sends his regrets, and I'm very pleased to be here in his place speaking about naturopathic medicine and its application to prostate cancer. So I'm going to just begin with a bit of an introduction. Thank you, Larry, for the kind introduction. As Larry mentioned, I'm part of the Ottawa Integrative Cancer Centre, and I'll be speaking a bit more about what we do at the centre, our approach to care, etc. And I'll let you know I am a naturopathic doctor, so that's what I'll also be talking a bit about as we get going. I would like to leave time for questions, so this will be a presentation I'm hoping on the shorter side. No promises, but we'll see how that goes. And leave questions for time at the end for you to ask any questions that you may have about the approach that we provide to cancer. So it's really nice to follow the Psychosocial Oncology and Ottawa Regional Cancer Foundation presentations, because I really feel like our work is very well matched, and it's delightful to hear words like whole person care, treating the whole person, being used in cancer care, because that really is the type of approach that we take as well. So just to give you an idea of what we're going to be talking about, this is an overview of the session today. So I will give you an introduction to naturopathic medicine for those that may not be familiar with this practice and exactly what it means. I will talk about the Ottawa Integrative Cancer Centre, or OICC as I will refer to it. I'm going to be talking a fair bit about research, because I think this is one of the ways that we are best positioned to contribute to naturopathic medicine, both in our clinical care, but also in the research initiatives that we have underway. And then finally, I do want to give you some information about the specific interventions that we use in supporting our patients that are going through treatments for cancer, and those that are beyond and into the years past their treatment as well. So, naturopathic medicine. So you may be wondering what exactly this is. So I'll just let you know that it is a system of medicine where we are using natural strategies to enhance the function of the body and really to optimize health and optimize that function. And we use a number of different tools. Some that are closest to my heart include botanical medicine and nutritional medicine, as well as lifestyle counseling. So this is talking to people about sleep, about stress, about all kinds of things that affect quality of life. We also do work in acupuncture and traditional Chinese medicine, so I get to play with needles. That's always fun. And also intravenous therapies, and we do have a list of prescription medications that are in our scope as well. So it's quite a broad tool chest that we have as naturopathic doctors, but really what underlies all of our treatments is this push to treat the whole person. So when somebody comes into me with a cancer diagnosis, I'm not just looking at that little bundle of cells called cancer. I'm really looking at them as an individual and them as a whole person, and looking at ways that we can support them going forwards. So a little bit about regulation, just so that you have some assurances in terms of what naturopathic doctors, what our scope is in Ontario. We are a regulated profession. We have licensing, and we do go through a 4-year training program at the graduate level. So have to do an undergrad, and then you get into the program, and then it's a 4-year full-time program. And in the last year of study, it's actually all supervised clinical practice. So it's pretty intensive. I'm delighted to be finished and not going back to school anytime soon. After going through that, we go through both North American and provincial licensing examinations. So I guess this is all just to say that when you're dealing with a naturopathic doctor, we haven't just taken a weekend course. We have, in fact, gone through some pretty grueling studies and examination. And in addition, when we get out into practice, we are licensed, we have a college, we're under the Regulated Health Professions Act, along with 26 other professions in Ontario, and that was a shift that happened in 2015 from our previous regulation. But many others are under this RHPA, including the practice of medicine, nursing, dentistry, and many others in Ontario. So this move is really positive because it kind of puts us all in the same sandbox, so we can all talk and play together, we hope. And that really is one of the goals of the work that we do. So in Ontario, naturopathic doctors are trained at the Canadian College of Naturopathic Medicine, and as Larry mentioned in the introduction, I've been affiliated with the college for many years. I did do a number of systematic reviews with my work in research at the college. There are just 2 accredited institutions in Canada, one here in Ontario and one in British Columbia, and as I mentioned, it's a 4-year training program. The last year of training involves supervised practice, and the college has its own clinic called the Robert Shad Naturopathic Clinic, that's the abbreviation there, RSNC, where there are over 25,000 patient visits every single year. So it's a huge clinic. It's, I think, if I'm not mistaken, the biggest in Canada, providing naturopathic care. We also have a number of satellite clinics that are in community health centers and other locations, and one that opened a few years ago actually within the Brampton Civic Hospital that provides naturopathic care to people coming into the hospital. So this is a wonderful example of the integration that we're really trying to foster and promote at the OICC. And the classes of naturopathic doctors graduating every year are somewhere in the neighborhood of about 100 from the college in Toronto. So lots of us getting out there into practice. And one of the most exciting achievements of the college in Toronto, the Canadian College of Naturopathic Medicine, is the founding of the Ottawa Integrative Cancer Centre, which I've been part of for more than 5 years now. So it really is an amazing place. I'm not sure how well known the name is, if people here have heard about it, but I will tell you more about it. So we were established in 2011 under CCNM, the Canadian College, to provide evidence-based, whole-person and integrated care for people that are affected by cancer. So we are a center for both research and treatment, and this is a really unique clinic, in my opinion, because of that, because we are positioned to both contribute to the research and then also utilize the research in our interactions with our patients, and vice versa, that our clinic experience informs the research as well. We have quite a diverse team, so the model that we have, I guess, is not dissimilar from those that you heard of earlier this afternoon with the psychosocial oncology program and the Maplesoft Center, where we have a number of different practitioners all working together and really trying to provide an integrated model of care. So we have NDs like myself, we have MDs, we have nurses, we have a nurse practitioner, a physiotherapist, we have registered massage therapists, a registered dietitian, a TCM practitioner, yoga therapists, counselors, researchers, etc. So it's kind of a busy place, lots going on all the time. We also have an interesting model of care in that, you know, much like the cancer coaches that you've heard from today, we have care coordinators that are the first point of contact for patients coming to the center. And these people are there to provide some level of counseling and support, but also help to connect people with the different practitioners that are at the center. And they also are there to support both patients and their families and caregivers as they go through their treatment for cancer. So you may be wondering, why are patients looking for additional care? Like, what are we providing? So these are some of the concerns that people come in with and reasons why they're extending beyond the care they're getting through the hospital to come and see us at the OICC. So additional things that they may like to work on include working with side effects of treatment, which is quite significant, supporting the immune system, helping with healing and recovery after surgery, improving quality of life, controlling symptoms of the cancer that they're dealing with, like pain, minimizing cancer-related disease processes, reducing risk of recurrence, and of course the mental and emotional support for themselves and for their families. We do also work with people that are looking to prevent cancer and helping them with strategies that they can put into effect in their lives. So it's all well and good for us to be integrative within our center. You know, we talk to each other, we share case information, and we craft treatment strategies that are best and most appropriate for our patients. But I guess the question is, how do we achieve this goal of being truly integrative with the wider medical model? And I guess the best answer to that is step by step. So that's something that we work on every day, really trying to coordinate our care with the care that our patients are receiving from other places, primarily from the hospital. And we do this by communicating, where possible, directly with the oncology team, with other care providers in the circle, including family doctors. And that is a helpful strategy, just so that people's care team are assured of the care that they're getting with us as well, and kind of know what it is we're doing. It's not just black magic. It actually has some research behind it. It's all things that we can defend with evidence. And the fact that we have an evidence-based complementary approach, I think, is also something that helps integration. Research is the same no matter who is reading it, whether you're on the complementary side or whether you're on the more conventional side. What's published is there in black and white for anyone to see. And that is really the evidence that we use to inform our practice. I do want to differentiate complementary and alternatives. So what we're providing to patients is not something to say, oh yeah, you don't need to have surgery, just do this instead, because we don't have evidence to say that that is going to be helpful. And so what we were doing instead is working alongside the treatments that people are receiving for their cancer diagnosis. So I think that's an important distinction for us to make, that we are providing complementary care. And something else that we do in order to really move towards this model of integration is to find opportunities to work directly with oncologists and with other people that are part of the conventional model. So this conference is a wonderful example of this, where we have representatives from different professions coming together and presenting information. And that does lead to alliances, that does lead to collaboration and cooperation. So I think participating in events like this is really important. Training opportunities as well. I actually had the pleasure this spring of speaking as a guest lecturer in the University of Ottawa Faculty of Medicine. They have a 1-week-long integrative medicine week, and I was able to lecture to the second-year med students. So opportunities like this really are very special and very important, I think, in moving ahead this model of true integration. But something near and dear to my heart that I think is a really important part of collaboration and integration is research, with a capital letters and an exclamation mark, because I do think research and contributing to the body of research that's out there does a lot to further the cause of naturopathic medicine and complementary medicine. So I just wanted to give you an overview of some of the collaborative research projects that the OICC is involved with. And there's quite a number here, and there's others that are in the works too, but these are some highlights. So probably our largest study and largest grant of $3.85 million was for what's called the Thoracic Poise study. And this is a 12-year-long randomized control trial between ourselves and the Ottawa Hospital Research Institute. And this is looking at patients that are getting surgery, thoracic surgery, so for either gastric cancers, esophageal cancers, and lung cancers. In one group, they're getting standard of care, and in the other group, they're getting standard of care plus naturopathic care. And this study will follow people for up to 5 years and look at some pretty important outcomes like survival. So this is something we're really excited to be involved in. I know it's not as relevant to the group here, but I guess it's just showing you that there are projects that are moving ahead where we really are testing naturopathic medicine in real life and seeing how things play out. Another one that will hopefully be unblinded soon is called the Ample Care Study. That was conducted at 8 hospitals across Canada, and that was looking at the use of melatonin, which is a hormone that you may have heard of in terms of helping to induce sleep, but has some anti-cancer properties too. And that was used in the context of non-small cell lung cancer in a population of over 700 people. So that is something we're keen to see the results of soon. Vitamin D in stage 4 colorectal cancer. This is a study that's being done out of Inspire Health in BC, and we are one of the recruiting sites for that project. And then finally, as Larry mentioned at the beginning, we've been conducting synthesis research. So doing overviews of the research, the published research that's out there, bringing it all together and trying to answer key clinical questions like, is it a good idea for you to have flax if you have prostate cancer? Is it a good idea to have soy if you've got estrogen-positive breast cancer? So I think this type of information is quite important to be getting out there to people, and we are delighted to be part of that. So what it really excites me about research, I'm kind of excited about it as you can tell, but is bringing this research back to the clinical context, because I have done a fair bit of research, but I see patients every day of the week, and that's really what matters to me, is bringing this information forward to the individuals that I work with. So applying research to clinical practice is really important, but something that I spend a fair bit of time doing with a research background as well is enhancing the research literacy of my patients. And I think somebody mentioned, Kip, I think mentioned about, you can Google anything and get an answer, and some of it's absolute garbage, and some of it might be a little bit sensible, and other, you don't really know. So I really try to educate people about what to look for when you're looking for things online and trying to answer your own questions, and trying to direct people to sites that have more evidence-based information. I've listed a couple here. PubMed, the World Health Organization, and the World Cancer Research Fund are all quite reliable resources. And really trying to distinguish between, this cures cancer, these wonderful claims about natural agents that unfortunately are just frequently not substantiated by enough research. Looking at the difference between in vitro or test tube type trials versus clinical trials in whole people, as we are all walking around. So looking at the different levels of research that are out there too. So these are some ways I try to bring research home to my patients in my visits with them. I also do try to help do a bit of a risk-benefit assessment of natural agents as well. So if someone says, should I take this? Well, let's look at it. Is it really expensive? Is there any research on it? Is it going to interact with your other medications? And going through that assessment and trying to determine, okay, if it's, you want to spend money on it, it probably is not going to hurt, but it may not help, that's your decision. But if there is going to be any harm from it, including what is the cost of this, then that's something to look at twice and maybe not, fill your cupboards with everything that the internet says is a good idea for treating cancer. But having said that, there's some really positive research out there too on quality of life benefits, immune and anti-inflammatory effects of natural substances. And even some evidence that some natural substances may slow disease progression. So some pretty important outcomes that we can share with people as well. So anyway, this is just how I like to bring research into my own practice. So I want to switch gears now to looking at some of the specific strategies that we use with our patients. And there's a lot of information, so I'm sorry. I hope you don't end up feeling too overwhelmed by the end of this, but I just want to give you a sampling of the types of approaches that we take. So looking at how we support people. So in our center, as I said, we have, I don't even know how many practitioners right now, over 20 different practitioners that provide different services. So very often the approach we take is a coordinated one that may involve people seeing our counselor, as well as our naturopathic doctor, as well as our acupuncturist and our massage therapist, and really trying to figure out what the best match is for the patient and according to their needs. We do really take the same perspectives as what you heard mentioned in the cancer coaching section about letting the patient drive the bus. Like, you're in charge, what are your needs? How can we best support and help you? So we have a number of different practitioners that we can bring together and really create a coordinated, cohesive care plan. But some things I'll be touching on are lifestyle factors and prostate cancer risks, specifically diet, exercise, alcohol, smoking, and weight management. The role of supplementation or of specific foods. So some of these I'm sure you've heard about before: vitamin D, lycopene, sulforaphane, and flax. And then briefly at the end, just touching on some sample integrative support strategies for treatments that people are going through. But I think before getting into this, I do want to offer a caveat, which is that you can do all the right things. You can do everything you were supposed to do to not get cancer and still get cancer. Just because you have a cancer diagnosis, it doesn't mean you did something wrong. So I think that's really important to state. So some of these comments may or may not be relevant to you, but I just want to make sure that nobody walks away feeling like, oh, it's because I ate that food that I have cancer. I mean, we don't actually know the cause of cancer in many cases. So I think going into this conversation knowing that is important. So the comments that I'm making as we go through are based in studies, and if you did want any references, just let me know after the presentation and I'd be happy to provide those. But I took them out of the presentation because it was looking a little cluttered. So anyway, but all the statements here are based on peer-reviewed studies. So exercise. This was mentioned earlier as an important factor, and I completely agree. The research, I'd say, is still equivocal on the precise benefit for people at different stages, but we know overall that exercise is probably not going to hurt you. It's probably a really good thing to do. And in fact, one study looked at walking 45 minutes a day. So this isn't going to the gym and completely wearing yourself out for 3 hours. This is walking for 45 minutes a day. Created a 31% reduced risk of dying of non-metastatic prostate cancer. So a pretty important outcome just by walking 45 minutes a day. So I'd say that would be something I'd recommend to everybody as something that would be a good thing that could make a difference. In addition to having a potential impact on cancer progression, we know that exercise is really helpful in terms of other important quality of life measures, in terms of potentially countering muscle loss, damages to sexual function, maybe to fatigue. So the side effects of therapy can be enhanced by exercise. Not for everybody, but it may be something worth trying to help. And in studies, it seems to show that, yeah, there is some benefit in some of these measures. I think we all know alcohol may not be the best thing for cancer, but there is more and more research, again, looking at this. We know that there's an increase of risk of prostate cancer, even in low amounts. So one study recently looked at less than 1 drink a day. It actually found some mild increase in risk. We still aren't clear if beer is any worse than wine. Do the antioxidants in wine really make a difference? We're not sure. So that evidence is still out there and evolving. But we know probably good to have as little as you can and still enjoy your life is what I usually tell people. Smoking does in fact increase the risk of dying of prostate cancer if you're smoking at the time of diagnosis. People that are continuing to smoke during their treatment actually may get less benefit from their treatments. So it's something to think about, and if this is something you're struggling with, then do ask for support through any member of your care team. There's lots of ways that you can be supported in terms of quitting smoking. It is not an easy thing at any point, particularly when you're dealing with the stress of a cancer diagnosis. So it's something that we are all very, very sympathetic to and very supportive of in terms of people's efforts that way. So looking at other lifestyle factors, obesity and abdominal circumference. So the maximum abdominal circumference in men is usually seen as 102 centimeters. And a recent study or survey by the, I think it was the World Cancer Research Fund, found that for every increase above that number of 10 centimeters, there was a 12% increased risk of advanced cancer. So that does show us there's something going on with abdominal circumference and cancer risk. And it may be that abdominal circumference is a marker or a feature of metabolic syndrome, which you probably have heard referred to. It's a constellation of 5 different symptoms, which is increased abdominal circumference, high triglycerides, that's the TG up there, high blood pressure, high blood sugar, and low HDL, which is the good cholesterol. So these 5 factors together create a syndrome called metabolic syndrome. And we know that this does increase risk of cancer, it increases risk of diabetes, of cardiovascular disease, but specific to prostate cancer, it may confer less, you may have poor recovery from surgery, and possibly an increased risk of biochemical recurrence. So this is an increase in the markers associated with prostate cancer, not necessarily growth of new tumors, but evidence of cancer in terms of changes in blood parameters. So again, this is something that's modifiable and something that we do support people with in terms of trying to achieve some weight loss, some lowered blood pressure, some lowered blood sugar, etc. And very accurately, it was said earlier that there is no diet to cure cancer, and I'm afraid I would agree with that. However, there are definitely some factors in the diet that we know have an impact on cancer. So it's something that I talk to patients about daily. It's something that I try to live my life as well, as consistently as I can. But I really do take this to heart, this idea that we need to guide people in terms of making the best choices around their diet. And what the research is showing is that it's not one food that's going to cure cancer or have an effect on cancer, it's your overall dietary patterns. And it's nice because this gives us maybe a bit of leeway in terms of, okay, it's all right that I had cake on my birthday, or it's all right that I had that cookie, but overall, what are you eating? Are you eating a plant-based diet, more or less? Are you having a large amount of fruits and vegetables in your diet versus processed and refined foods? So what we try to encourage people to follow is something resembling the Mediterranean diet. So this is a diet that is high in fruits and vegetables, has a fair amount of fish, olive oil, legumes, and a moderate amount of alcohol. And what I found in looking at the research recently was a decreased risk of being diagnosed with a high-grade cancer and also a reduced mortality after diagnosis. So, okay, maybe we can't cure cancer with diet, but this evidence does seem to suggest that we can have an impact on it in some cases. So changing patterns towards a diet that's higher in its vegetable and fruit content, I think, is something that we can all do. Some vegetables may be tastier than others, but still, get them on the plate. So beyond diet, looking at supplements, and I know this is there's a lot of questions around this, and around the evidence around the benefit, but there certainly is some signals in the research that point us towards using some supplements in the care of our patients. And admittedly, the evidence may not be as robust as we would like, but there's enough there for some of the suggestions that we make to be substantiated. So it's possible that including these nutrients in the diet could be helpful, potentially using the supplements. We don't have enough research to say, are the supplements as good as the food, or vice versa. But sometimes supplements allow you to get a very concentrated amount of a particular substance that has had some research done on it. So one of my favorites, and probably the first one I talk to many people about, is vitamin D. So I don't know if everyone takes vitamin D, and I can't make recommendations from here, but it would be a good thing to consider and discuss with your care team. Vitamin D is something we're seeing more and more research about. A 2010 study found that the average Canadian has levels of vitamin D that are insufficient, and this includes people who are out in the sun. This includes people who are down south for the winter. So I guess this goes to show that living at the latitude that we do, we just are not getting enough vitamin D from the sun. So many people need a supplement, but that is, again, something that I can't tell you to do. So talk to your doctors about that. But we know that low levels of vitamin D will increase the risk of aggressive disease. And in a study that was done not that long ago, they found that taking vitamin D was actually associated with fewer positive cores on repeat biopsy. So it does seem to be having a tangible effect on cancer. So anyway, that's something to think about, something to just sort of file away as something that could be helpful. Lycopene, which I'm sure everybody has heard about, perhaps ad nauseum, is something that I guess came up, gosh, it must be about 15 years ago, in the research as potentially being helpful in prostate cancer. There are a lot of food sources of lycopene. Tomato, watermelon, papaya, rosehip are some of them. And a meta-analysis, which is a study that brings together a number of different studies and actually pools their findings to make a new study. And it's considered to be a very high level of evidence. And this study did find that higher consumption of lycopene and lycopene-containing foods was associated with a lower risk of prostate cancer. And the amount that they looked at in the study was equivalent to what's found in a cup of tomato juice or half a cup of spaghetti sauce or 20 milligrams in a supplement. So these are some interesting findings. Again, not something that I would say would be curative, but something that may slow disease progression potentially, or may at least reduce people's risk of diagnosis in the first place. So if there's a family history, this could be just something, make sure there's tomatoes on the table. Sulforaphane is found in the cruciferous vegetables, particularly broccoli, and particularly the broccoli florets. So not as much the stems, but the top of the broccoli. And a study found that taking a supplement with this sulforaphane in it actually made for longer PSA doubling time in some patients. And in the study, they also found that people that had an increase of PSA by more than 20% over 6 months, there were more of those people in the control group versus the treatment group. So broccoli is a source of that. Ground flax is something that maybe you've heard of before too. I frequently use it in my patients that are having constipation concerns. It can be very helpful for bowel support, but there seems to be some signals of benefit in terms of prostate cancer as well. So this is something else that I frequently recommend. And then, oops, sorry, this was the slide on flax. And then this is looking at ways that we can support people as they're going through treatment. So this is looking at androgen deprivation therapy and acupuncture. So there's not awesome research on this, but there's some. There's some saying that the hot flashes that people experience after having, after starting androgen deprivation therapy may actually be helped by acupuncture. So a couple of small studies that did suggest that there was some improvement both in severity and frequency of hot flashes. And the second study, or a second area of concern that was already mentioned as well, was on sexual dysfunction as a side effect of androgen deprivation therapy. And unfortunately, this review did not find clear benefit, so it's, nothing is black and white. But there are some studies in the research that do show some people having benefit with sexual function and acupuncture. So I guess what I present to my patients is that, if you're okay with having acupuncture, you're okay with the needles, then, it may be worth trying and just see what happens. The risk of harm is very low, but if there's a potential risk of benefit for something that I know can be a very troubling side effect, then it may be worth trying. And then the last one I'll talk about is supportive strategies during external beam radiation. So skin toxicity and irritated skin is certainly one of the more common side effects that people have. And calendula cream is an extract from marigold, and this actually has some research on it showing that it may be beneficial in terms of helping skin integrity and help to prevent the dermatitis that comes with radiation treatment. And then secondly, radiation-induced diarrhea. And it was found in a recent meta-analysis. So again, that's another one of those big studies that brings together lots of little ones. They did find that in people that took a probiotic before their treatment, they had less in the way of treatment-associated diarrhea. So these are strategies that, I do recommend, but I would also certainly first and foremost recommend you speak to your care providers about. But there is more and more awareness of natural therapies. There's more and more research. Like I said, the comments that I've made have been coming from published studies that are out there in the literature. So it's certainly available to anybody to read. So in closing, I'll just say that an integrative care model really does provide the best care options to our patients and their families. And research collaborations, yay research, do foster powerful interprofessional alliances. We know that exercise, alcohol restriction, smoking cessation, weight management, and the Mediterranean diet could all contribute to better outcomes in prostate cancer. Eating tomatoes, broccoli, which has the sulforaphane in it, flax, and maybe vitamin D is, maybe something to think about. And finally, things like acupuncture, probiotics, and calendula could be helpful during treatment. So anyway, that's a sample, but there's certainly lots of other things that can be helpful. Anyway, I will end here, but thank you very much for your attention today. And if there are any questions, I'd be happy to take them now.
Controlling your pH level. That's something that's helpful in cancer.
That's a great question. So you're asking about like the acid-alkaline question. So lots of talk about this, lots of discussion. And people will sometimes come in to me and say, okay, so I'm testing my urine pH every day and I'm freaking out because I ate a lemon. Is that acidic or is that alkaline? Is that okay? And I haven't seen evidence to say that it's helpful, to be totally honest. But when people are on this type of a diet, which encourages you to have less in the way of meat, less in the way of sugar, more in the way of greens, if they're not stressed by it, I don't usually object as long as it's nutritionally complete, because it lines up very nicely with the dietary recommendations that I make to people anyway from an evidence-based anti-cancer perspective. So I'd say it's not something to stress about, but the foods that you're probably eating on that diet are ones that are usually plant-based and high in the antioxidants and things that I would want people to be consuming as part of their diet anyway. But the urine test and salivary test I know can be very stressful for people. So if we can take that piece out, you may be left with a diet that hits on some of the pieces that I mentioned here today. Yeah.
In one of your early slides, you stressed that you're practicing complementary and not integrative approach. Can you explain the difference?
I differentiated actually between alternative and complementary. So not offering strategies that we're positioning as being things that could be done instead of the conventional plan. So, somebody is being proposed chemotherapy. Could you just, take Lycopene instead? We're not positioning our therapies that way. So I'm differentiating between complementary on one side and alternative on the other. But integrative and complementary, I think the medicine we practice is both of those things. Did that answer your question? Okay.
Hi there.
Hi.
Just during your speech, not once did you mention the S word until the very end there, and that's sugar.
Sugar, yes.
And I've done a lot of research, did a ketogenic diet, all kinds of different diets, and sugar is #1 culprit for cancer. But I'm not sure why you haven't mentioned sugar more so.
Well, I'm very glad you brought it up. It is something that I do counsel people to avoid. And I guess, looking at evidence from things like metabolic syndrome and its links to cancer, we know sugar plays a role. There is suspicion that it's not just sugar, but also insulin levels and insulin resistance that certainly may play into cancer progression. So yeah, in my practice, I talk a fair bit about sugar as well. And as with alcohol, try to get people to have as little as they can from refined sources. You mentioned the ketogenic diet. So in my own practice, I see benefit from having fruits and things like that that have antioxidants, that have some natural sugars, but also contain fiber. But there are different approaches that steer away from that completely, and not having much in the way of fruit-based sugar either. But I agree with you. Thank you for raising that. And yeah, sugar is also something that I do counsel people to reduce. I guess I didn't bring it up also because the evidence on it is still evolving, and it's something that I wouldn't say is widely accepted yet as a strategy, but it's something I certainly do employ in my own practice. So thank you for mentioning sugar.
A lot of your slides talked about preventing prostate cancer.
Yep.
So there's a lot of us here, like I had my prostate removed 4 years ago. So a lot of your slides, would it be the same as if the cancer comes back? Could you do all this to help prevent the cancer from coming back, or do you treat many people where the cancer has come back?
So thank you for raising that, and it is more of the research when you're looking at diet is looking at prevention of risk, prevention or reduction of risk, preventing primary prostate cancer, so first diagnosis. And I realized as I was preparing this that most people here, if you're attending a conference like this, have probably had some experience, and you're looking more at secondary prevention. We don't have the evidence yet to say, can you extrapolate one to the other? I do. Whether that's, truly evidence-informed or not, I don't know. Possibly not. But I wish we had more in the way of evidence on secondary prevention. But I wouldn't think there would be much difference. If you're finding strategies that are impacting cancer cells in the context of either primary or secondary prevention, I would think that it's sound advice. But you're absolutely right, that more of it is looking at primary, and that's just what's in the literature right now. But I'd love to see more.
Okay, I have 2 half questions. One has to do with fish oil. I hear a lot about it. I'd like to hear your response to that. And the second one is, when you go for supplements, there's the issue of quality control, and how do you suggest that you could manage this?
Okay, thank you. So 2 questions, one about fish oil and one about quality control. I guess the quality control I will address first. It's a tough one. There are a number of studies out there that say that, they look at supplements, what's on the label, what's in the bottle, do they actually match? There is a bit more regulation these days than there has been previously. A lot of natural health products will have an NPN, or natural product number, on them, at least indicating that Health Canada has reviewed the claims that are made on the bottle. In terms of what's in the bottle matching what's on the label, sometimes it's anyone's guess. I go with professional lines where I know the companies, and I've talked to them and I've asked them about their ingredients, and I know they use something called, I think it's Good Manufacturing Practice, GMP, and so look for that seal on the bottle. But also, if they have third-party certification, it may just be a matter of even talking to them at the health food store, what do you know about this company? Are they a good company? Do they check their ingredients when they come in the door? So the companies that I deal with will do a verification of the raw ingredients when they arrive, and then they'll do checks along the way through the production process. But unfortunately, there's a lot of not great supplements out there too. So I guess the advice I'd give you is buy from reputable sources. And speak to the people that you're buying them from to try to be assured of that. Fish oil is a great topic as well, and it's something that if I'd had hours to talk to you today, I would definitely have included. In the Mediterranean diet, fish does feature prominently, and we do know that there is a certain anti-inflammatory effect from fish as well as from fish oil. So it is typically something that I will recommend if it's indicated. And I guess in terms of prevention, I haven't seen strong evidence. I mean, there's some evidence saying that having more omega-6 fatty acids is problematic in prostate cancer, that you should have more of the omega-3s. So my sense generally of the research is that fish itself is helpful and beneficial potentially. So I wouldn't be opposed to a fish oil, certainly. It's something that I do use frequently with my patients. I guess I always try to look to see, are there other reasons why we are using this? You know, is there, because the evidence on it from a cancer perspective is not rock solid, like are there cardiovascular reasons, or are there skin reasons, or are there, you know, other immune questions that may be there that may make this a more appropriate recommendation? I try not to have people leave with like 15 supplements because no one likes that. But thank you for your questions.
Yes, do you have any comments with respect to taking supplements like Greens Plus or Veggie Green?
Sometimes I have patients come in who are like, well, I had that. I don't need to eat vegetables, right? So I don't think the two are equivalent. I think that you do get some of you know, the nutrients that are in the greens powders, but you certainly lack things like the fiber, like the if you're having fermented foods, any probiotic benefit that might be there. In the case of sulforaphane, for example, it is released when you chew the broccoli. So I don't know, can you get that in a powder? I'm not sure. It's something that, you know, you're fine to add into your beverages, into your smoothie, but I don't think it is equal to a vegetable, in my opinion. But if you have other information, I'd love to hear it too.
Sweetener versus sugar, natural honey?
So I always get this question. I believe the Canadian Diabetes Association says that honey is okay. And I mean, honey and other sugars, including maple syrup, brown sugar, they will all increase your blood sugar. So I do tell people to use honey and other sweeteners in moderation. Some sweeteners, so things like stevia, don't increase your blood sugar. So because I'm concerned with the potential role for insulin, I'm okay with people using stevia. But I think the problem with artificial sweeteners is it doesn't necessarily curb that sweet craving. So I think it's a bigger question too of the role of sweetened foods in our life, in our society. Can we change and alter our diet so that we're just eating less in the way of sweetened foods overall? What are we getting from the foods? Can we substitute fruit instead and target that craving that way? Or sometimes people have sweet cravings because they're actually just hungry and need to eat some protein, and that levels out the blood sugar in a way that eliminates the need for anything sweet. So I think the studies in terms of weight loss and sweeteners have not been, I don't think they've shown a great deal of help in terms of weight loss from sweeteners. So I personally tend not to recommend them, but if the odd one is needed, then I usually recommend stevia.
There's some interesting evidence about metformin, statins, and low-dose aspirin as it relates to prostate cancer. Could you speak about that?
I wish I could give you a short summary of all of it. It is evolving. I think that as a, I believe it's a COX-2 inhibitor, the aspirin has some anti-inflammatory effects, and we know that inflammation does have potentially a role in cancer progression. So it's not something I use routinely myself. I mean, it's over the counter, but because there are potential harms in terms of digestive function, stomach health in particular, so it's something I'm a bit careful about. Metformin, yeah, there definitely is some interesting research there of people, for example, people that are diabetic that are not treated with metformin having poorer outcomes in cancer than those that are treated with metformin. But I know it is being used in people that don't have a diabetes diagnosis specifically for its effect in cancer. So it is something we do use ourselves periodically within the center. It's not in my scope, but our MD and NP can prescribe it. So it is something, yeah, we certainly are aware of the research. And sorry, what was the third one? Statins. Statins I haven't read up on recently, but I know I've heard bits and pieces here and there. So I'm sorry I don't have sort of a well-distilled summary of the research that's out there right now, but I certainly acknowledge they may have their role in cancer care.